Hi everyone there. My name is Shaali. I'm the NTD manager for Zanzibar, and I would like to share with you our One Health work, which focuses on increasing implementation of One Health in Zanzibar. So let's look on the context of One Health in Zanzibar. So the One Health is already integrated into the NTD master plan, strategic plan, and we're intending to intensify collaboration and multi-sectoral action in the concept of One Health to ensure inclusion of NTDs in the national One Health platform. So far, Zanzibar has One Health platform under the second vice president with One Health desk under the disaster management. And there's a comprehensive One Health strategic plan for Zanzibar, but the implementation has been limited to emergency response and antimicrobial resistance so far. We have taken some steps, and what is very important to understand on how to initiate cross-sectoral One Health actions and ensure inclusion of NTDs in the national One Health platform. So there's no precedent for endemic disease program to link One Health platform. So we have convened initially 2-day meeting of government stakeholder from across sectors, which included Minister of Health. In particular, there were members from NTD and other areas and other sectors, and other sections, but also we had district offices, agriculture, veterinary, public health, forestry, wash, and tourism. So the workshop explored One Health work already done and how the health system could be set up in the future to best serve community needs. That is taking the cross-sector One Health approach. So in summary, our first workshop focused on the implementation of One Health. So the results of the first cross-sector workshop was overcoming the barrier for implementing the One Health. But of course, as part of the first workshop, the participant identified barrier to working in a more integrated way and also found the root causes for why One Health approaches were not being implemented. So we found 2 gaps and we prioritized for planning a solution. So as a workshop output, the team or the participant came up with the roadmap on how increased knowledge and skills for One Health implementation should be delivered. So the second cross-sector workshop applied One Health skills and definition and defining competence. So the competence list for in-service personnel across sector, but is not discipline specific. And we used the RAS approach in the planning to identify roles and responsibility. And we have also come up with a community of practice for Zanzibar One Health network. And the training exercise we had focused in core One Health skills, for example, the systems mapping. But in summary, our second workshop was mostly focusing on knowledge and skills for implementing One Health. So what will be our next step? First and foremost, our collaboration with the One Health desk is still ongoing. And already there is an establishment of knowledge and skills training platform, which is in hybrid format for One Health focal point in different teams and ministry. But the question remains on how we will now apply our learning and resources for NTD specifically. So our next workshop will be on advocating for uptake of One Health ways of working and for resource mobilization. So as a reflection, one has to ask himself how to start the One Health. So one needs to create an opportunity to build relationships and form a community of practice across sectors. need to have a leadership skill. Of course, we are all One Health leaders, but one need to understand distribution of decision making and where there's capacity for staff to do the work. This may be in different departments, but what is very important in One Health that what One Health is focusing on forces to decide the level of integration, and these forces standing for communication, coordination, collaboration, and if there's a need to be any capacity building to allow this way of working. So the leadership quality is very important for One Health implementation. Thank you.